students, welcome to the study portal. In today's lecture, we will be understanding the sources, function, requirement and absorption of different vitamins. So, starting with the learning objectives, we will be discussing the different sources, functions, what are the requirement of different vitamins and how the absorption can impact if we are taking the vitamins. So the first thing is vitamins are essential micronutrients required for various psychological functions in our body, and they are classified into two categories mainly. First is fat soluble vitamin and second one is the water soluble vitamins. I hope you all remember about the fat and water soluble vitamins. Fat soluble vitamins are A, D, E, K, whereas the water soluble vitamins consist only two categories, which are vitamin D complex and second one is the vitamin C, that is also known as ascorbic acid. As they are not synthesized in our body, so it must be very mandatory, like it is required to take from outside in various food sources so that we can fulfill the requirement of our body to help the body function in different things, and it can be lead to the excellent process of energy yielding and metabolism, and many functions are associated, like it will be providing the support to the nerve function, DNA synthesis, bone repairment, and also preventing the different disorders that we have discussed. So the vitamin A, there are different sources that are available for the vitamin A, mainly focused on vitamin like dairy products, whether it is milk products or whether it is the liver of any animal, and some of the additional sources can be obtained from many of the vegetables like carrots, sweet potatoes. Amlas are very rich in vitamin A and vitamin C also. There are the different functions which are played by vitamin A. That is, it supports in the vision, plus it also helps in the immune function and the cell growth of the body. Now, the dietary requirement, that is the minimum requirement, between 600 to 900 microgram of vitamin A per day should be provided to a healthy individual to fulfill the daily requirement. And the absorption factor, like it is a fat soluble vitamin, so it is associated with the fat absorption, so it requires a dietary fat that is inhibited by malabsorption disorders. Means there are multiple disorders that hinder in vitamin A absorption, such as Crohn's disease, celiac diseases. So it is required to take with vitamin A so that absorption can be done in efficient manner. Now, talking about the vitamin D. So there are different sources which are available, like mainly we can take the vitamin D from sunlight, fortified milk and the fatty fishes. It is also recommended to take vitamin D with fats, and the different functions which are played by vitamin D is it helps in the calcium absorption and bone health, and it also supports the immunity of our body. Dietary requirement, that is between 600 to 800 IU per day for a healthy individual. Now, absorption factors. So it requires bile, salt and fat reduced in the kidney and liver diseases. When there is any individual who is suffering from any of the kidney and liver diseases, at that time absorption of vitamin D can be at a lower size. Vitamin E. So the vitamin E, there are different sources which are present and which supports the from which we can get the vitamin E in our body. So the vegetable oils, nuts, like you can see in this picture, avocado, different types of nuts, almond, walnut, even the spinach, and capsicum are the rich sources of vitamin E. There are multiple functions which are played by vitamin E, like antioxidants. It is a kind of antioxidants. So ultimately, it will be balancing the free radical in our body, protecting the cell membrane of the body, and the dietary requirement is only 15 milligram per day, and that is the healthy requirement of a healthy individual. Now, absorption factors. So, it also requires the fat impaired with the fat metabolism. So, all the water soluble, like all the fat soluble vitamins required and suggested to be taken with fat so that it can aid in the absorption process too. Now, vitamin K. So the sources are different, like green leafy vegetables are more rich in vitamin K, broccoli, liver and gut bacteria. Plus the functions that helps in the blood clotting and bone metabolism. Dietary requirement is only 90 to 120 microgram per day, and the dietary like absorption factors also requires the dietary fat and healthy gut microbiota. So these are the factors which are associated with the absorption of vitamin K. Now, vitamin B1, that is water soluble vitamin. So there are different sources which are available to fulfill the requirement, like whole grains, pork and legumes are rich sources of vitamin B1, and it helps in the energy metabolism and nerve function of the body. Like that, talking about the dietary requirements, so it is only 1.1 to 1.2 milligram per day, and the absorption factor, it is inhibited by alcohol and raw fish. Like if we are taking the alcohol and we are taking the raw fish, in that condition it can hinder the vitamin B1 absorption. Now talking about riboflavin, that is also known as vitamin B2. So the different sources are milk, eggs, lean meats and the green vegetables. Function that is played by vitamin B2 is energy production and it is antioxidant functions, like it will be ultimately balancing the free radicals in our body. Dietary requirement is 1.1 to 1.3 milligram per day, and absorption factor, it is very sensitive to light. So it is if we are taking any of the supplements, so it is suggested to keep or store the vitamin B2 in a very cool and dark place. And absorption may be reduced in elderly, means as the age increases, it can hinder the absorption of vitamin B2. Now, talking about vitamin B3, that is also known as niacin. Different sources of this vitamin is available, like meat, fish, poultry and whole grains. Functions which are played by this vitamin is metabolism, DNA repair and skin health. Simultaneously, the dietary requirement is only between 14 to 16 milligram per day, and absorption is done when the adequate protein, like tryptophan, is needed for the synthesis. Like appropriate adequate protein is needed for the synthesis, and this is all about vitamin B3. Now moving further, the vitamin B6, B9 and B12. So the different sources of vitamin B6 is banana, meat. For vitamin B9 is leafy green vegetables, mostly focused on this. And for the B12, animal products are suggested to be taken. Now there are different functions which are played by these two vitamins, like amino acid metabolism, DNA synthesis and the nerve function. These vitamins contribute in these functions, and the dietary requirement for vitamin B6 is 1.3 milligram, B9 is 400 microgram, and for the B12 it is 2.4 microgram per day. Absorption factor. So B12 needs intrinsic factor like folate affected by alcohol. in many of the conditions, what happens when the individual is consuming high amount of alcohol, in that condition it can hinder the absorption of these three vitamins. Now talking about vitamin C, ascorbic acid. So there are multiple sources which are available for this vitamin, mainly focused on citrus fruits. Like you can see in this picture, grapefruit, red bell pepper, oranges, lemons. Guava is also very rich source of vitamin C, plus carrots, ginger you can see, and broccoli. Tomatoes can be added to get the vitamin C also. It is also an oxidant. It helps in the collagen synthesis in our body and also plays a major role in the absorption of iron in our body. So the dietary requirement is 75 to 90 milligram per day, and the absorption factor, heat and oxygen, can degrade vitamin C. So the vitamin C is very sensitive toward the heat and oxygen. Now talking about the dietary requirements. So the requirement vary by age, gender, physiological status. As we have knowledge about different ages, different genders, and the psychological status. There may be, like if I talk about the ages, there can be any early childhood, a person from early childhood, late childhood, whether the person is from adolescence, adulthood, or from the old age group. So on the basis of the age, again the gender and the physiological status of the bodies, dietary requirement will be varying, and the fat soluble vitamins are stored in body, so there is a high risk of toxicity. Whereas for the water soluble vitamins, there is a very low risk of toxicity of these vitamins because they are excreted in the urine when taken in abundance. Deficiencies can lead to serious health issues, so it is suggested to monitor and take a regular amount of vitamins that is required by our body. Now, factors affecting absorption. One more thing, as fat soluble vitamins are stored in our body, so the deficiencies it can take a long time to identify the deficiencies by the visual appearance, but water soluble vitamins can show a tendency. Like there are multiple tests nowadays available to check the deficiencies of different vitamins. Now, factors affecting absorption. So the fat soluble vitamins require dietary fat for absorption, whereas water soluble vitamins doesn't require any of the fat or any other thing for the absorption. Now, the digestive disorders can hinder in the absorption process, like celiac disease, Crohn's disease can impair the absorption of fat soluble vitamins. Now, again, the age, alcohol use, and the medications can affect the uptake. Cooking methods can reduce vitamin content. So, multiple, if I talk about the water soluble vitamins, whenever we are taking any of the food which is rich in vitamin like B or C, if we are cooking or overcooking the food at that time of cooking, as the vitamin is already water soluble, so it can evaporate while the process of cooking. So it is always recommended whenever we are cooking food, we should mostly focus on the cooking by covering, so that the additional loss of vitamin can be reduced and the nutrients that are available in the food can be given to the individual. And we should also opt for the cooking methods which are beneficial and which are keeping the nutrients in the food itself. Now, improving vitamin absorption. So as I also discussed about, the different cooking methods can be included in the food preparation so that it can help to sustain the vitamins, like percentage of vitamins which are present in different foods. and it pair fat soluble vitamins with healthy fats. Example, olive oil and nuts can be taken for the fat soluble vitamins. Avoid overcooking vegetables. Like again, we should be avoiding the overcooking to use the optimal amount of vitamins which is present in foods, and we should also use the steaming or microwaving, which can protect the vitamins. Like leaching of vitamins can be decreased. Now consume a varied and balanced diet. So it is very necessary to have a balanced diet to maintain all the vitamins in our body. Consider supplement only when it is suggested by any of the doctor or you are taking under professional guidance. Because if you will be taking the vitamins by your own choice, it can also lead to the toxicity of particular vitamin in your body. So this is all about today's class. Thank you.